Hello, I'm Dr. Roxana Sulica. I'm the director of the Mount Sinai Beth Israel Pulmonary Hypertension program in New York. And I will be talking about my poster presentation at the ATS meeting 2017 about the washout period that's required between treatment with PDE5 inhibitors in patients that are transitioned to Riociguat for the treatment of PAH. PDE5 inhibitors and Riociguat, which is a soluble guanylate cyclase inhibitor, they are two separate classes of drugs in pulmonary arterial hypertension that work on a nitric oxide pathway. They act on separate molecular targets, but on a similar pathway, which is the nitric oxide pathway. And the question that we have is, can we use these drugs together to enhance the nitric oxide pathway? And if we can't, for safety reasons, what is the time interval that you have to place between the administration of two classes of drugs in a safe manner? The side effect that we're trying to avoid would be hypotension, because it's literature showing that they may be enhancing the hypotensive effect to each other. We have data from an 18-patient European trial, placebo-controlled, randomized, double-blind placebo-controlled trial, in which people that were receiving sildenafil have been randomized to placebo versus Riociguat. And that was a trial that was designed particularly for safety issues. Nothing really panned out in terms of increased safety signal at 3 months. However, in the open label extension, they had a couple of incidents of systemic hypotension. Based on that trial, it's clearly contraindicated to use any kind of PDE5 inhibitor with Riociguat. Now, it's evidence accumulating of a transitioning of patients from PDE5 inhibitors to Riociguat, and the question is, what is the safe and the optimal interval between one class versus the other class of drug administration? Based on pharmacodynamic data and based on the half-life of sildenafil of 4 hours, the washout interval between sildenafil and Riociguat is recommended to be 24 hours. For Tadalafil, we have some evidence between administration of Tadalafil, a 20 milligrams dose in healthy volunteers, in patients with diabetes, and patients that receive nitroglycerin. There is no contraindication and there's no effect, no hypotensive effect that's noted after 48 hours. So the hemodynamic interaction inducing hypotension, systemic hypotension, it's evident up to 24 hours of co-administration, and nothing is seen after 48 hours, reason for which the washout period between Riociguat and Tadalafil, or Tadalafil and Riociguat rather, is 48 hours. In the study, the pilot study by the name of Respite that looked at transitioning from patients on PDE5 inhibitor to Riociguat, the washout period was 24 hours for sildenafil and 72 hours for Tadalafil. But we hope that with the current knowledge, we can justify the label change of washout period of 24 for sildenafil, 24 hours for sildenafil and 48 hours for Tadalafil. And also we can justify the protocol written for the follow-up study, replaced study of transitioning from PDE5 inhibitors to Riociguat, where the washout period for Tadalafil is 48 hours, based on the data that we presented. Thank you for your time and attention today.